Hello guys, let's discuss about hepatitis B. Hepatitis B is the most important topic among all the other topics. The etiology is hepatitis B virus, which is a hepatotrophic DNA virus, it is mostly affecting the liver. It belongs to Hepatnaviridae family. The structure and genome, it is a complete infective virion as a DNA particle, which is a double-layered hepatitis B virus. It is formed of inner core of nucleocapsid, which is 27 nanometer, and outer envelope of hepatitis B surface antigen. So the hepatitis B virus has many forms, such as circular forms, filamentous forms, but the infective form is only one, which is known as the Dane particle, which is 42 nanometer and double layered. It consists of a partially double-stranded circular DNA. It has four genes. So first, let's understand about the composition of hepatitis B virus. It has S gene, C gene, P gene, and X gene. The S gene forms the hepatitis B surface antigen, which is generally secreted in the blood. The C gene forms hepatitis B core antigen and hepatitis B pre-core antigen, which is HBeAg and HBcAg. HBcAg is the core antigen which remains intracellularly and does not circulate in the serum. Whereas HBe antigen, it is a marker for high levels of replication and infectivity, and it is secreted into the serum. The P gene forms the DNA polymerase, which is helpful for viral replication. The X gene is necessary for infectivity, and it is also implicated in the pathogenesis for cancer. The source of infections refers to humans suffering from hepatitis or carriers of hepatitis. This hepatitis B virus, it is 100 times more infectious than HIV and 10 times more infectious than hepatitis C virus. Let's look at the mode of transmission. It can be transmitted by vertical transmission or horizontal transmission. The vertical transmission refers to transmission from the mother to the child, and it can be transmitted either in utero during parturition or soon after birth. But is then generally not transmitted during breastfeeding. Horizontal transmission, it is the dominant mode of transmission, and it may be parenteral transmission or by close personal contact. The parenteral transmission can either be percutaneous transmission or by intravenous transmission. Percutaneous transmission through minor cuts, abrasions in the skin or mucous membrane. There will be exposure of body fluids into these cuts, such as occurs in needle stick injuries. Intravenous route includes transfusion of unscreened infected blood, which is very rare mode of transmission, or in case of intravenous drug abusers, sharing of needles and tattooing. Close personal contacts by the body fluids, this will be secreted in the saliva, urine, semen, and vaginal secretions. The incubation period is 30 to 180 days, which on average is 8 to 12 weeks. The chronic carrier state is seen in 1 to 20 percentage of the individuals. The clinical features of hepatitis B is same as that of hepatitis A virus. These are the clinical features for acute hepatitis B virus, which has a phase 1, which is an incubation period. Phase 2 is a pre-icteric phase where there's before the onset of jaundice, there'll be nausea, vomiting, poor appetite, fatigue, malaise, headache, and anorexia. There's low grade fever, which is more common in hepatitis A and D, and also vague abdominal pain. The symptomatic icteric phase will have clinical jaundice, and prodromal symptoms will diminish in this phase. There'll be dark urine and pale stools. The liver will be enlarged and tender. The phase 4 is recovery, which in case of hepatitis B virus is 3 to 4 months. Let's look at the prevention of hepatitis B virus. So, for preventing, we have to avoid the risk factors, that is, advocating safe sex practices, avoiding needle sharing, safe blood products, and avoiding needle prick injuries. Also, we have active immunization and passive immunization for hepatitis B virus. The active immunization is the recombinant vaccines which contain the hepatitis B surface antigen. In children, it is recommended in all the children, and in adults, it is recommended in high risk groups such as healthcare professionals, hemophiliacs, intravenous drug abusers, hemodialysis, and sexual contacts of hepatitis B antigen, HBs antigen carriers. In less than 10 years of children, 10 microgram intramuscularly will be given, and more than 10 years 20 microgram intramuscularly is given. It is given in the deltoid at 0, 1 and 6 months. Also, combined prophylaxis can be given, which includes vaccination and immunoglobulin. The dosage of immunoglobulin is zero point zero 0.05 to zero point zero 0.07 milliliter per kg for adults, and in case of newborns it is 200 international units. In case of newborns it is given intramuscularly. The indications of it will be accidental needle stick injury or exposure to infected blood, newborns born to HBs AG positive mothers, and regular sexual partners of HBs positive patients. The treatment of acute hepatitis B is same as that of acute hepatitis A, that is just the symptomatic treatment. But antiviral drugs can also be given, such as pegylated interferon alpha, lamivudin, telbudin, entecavir, tenofovir, and adifovir. So, of all these, mostly tenofovir and entecavir is nowadays used. As lamivudin, it is the virus is mostly resistant to lamivudin. Therefore, lamivudin is not generally recommended nowadays. And pegylated interferon alpha has side effects, a lot of side effects. Therefore, that's also not recommended. So that's all about acute hepatitis B. Thank you.